This is a contrast and CT scan of a 84 years old male patient. The patient has been a smoker for the last 40 years. Patient is a known case of adenocarcinoma of lung. The association of squamous cell carcinoma with the smoking is much more as compared to that of the adenocarcinoma. Now please observe linear irregular thickenings of the interlobular septum in left lung. There is loss of lung volume on left side because the adenocarcinoma lies in the left lower lobe. Now this is a cavity here. This is the mass lesion in this region showing extrathoracic extension. I will show you the mediastinal window later on. Please observe lymphangitis, carcinomatosis on left side. Now these interlobular and intralobular septal thickenings may be because of the smoking related interstitial lung disease. There is metastatic erosive destruction of right 8th rib and right 2nd rib. This one here. Now I will show you his mediastinal window. This is a cavity in the lesion which has involved apical and the posterior basal segments of left lower lobe. Now this is the mediastinal window. Please observe this mass which has involved posterior part of the apical and posterior basal segments of left lower lobe. This shows extrathoracic extension through the intercostal spaces. Please observe that this is involved left erector spinae muscle. The mass shows intraspinal extension through the respective intervertebral foramina. This one here, it has compressed spinal cord, pushing it across the midline onto right side. Please observe the intraspinal extension through the intervertebral foramina. Now this left transverse process is eroded. The mass has surrounded ribs. The ribs are also eroded in the region of the mass extending extrathoracically through the intercostal spaces. Low down, these are the extrapleural metastases here. If I scroll it down, this is an enlarged left retrocrural lymph node. Low down, there is another metastatic lymph node lying posterior to the upper part of abdominal aorta. This is a metastatic lymphoid mass in left hilar region. This has partly surrounded left main bronchus, and this shows extension into the adjacent mediastinum. The mass has surrounded left lower lobe branch of pulmonary artery. And proximal parts of the segmental arteries. This is the sagittal scan. Please observe this is the lymphoid mass which has partly surrounded and significantly narrowed left main bronchus. This is surrounded. This is the left lower lobe branch of pulmonary artery. showing extrathoracic extension through the respective intercostal spaces surrounding ribs and eroding these ribs as well. This is the coronal scan. I just want to show you the intraspinal extradural extension of the adenocarcinoma. This one here, compressing adjacent spinal cord. Please observe these erosions of the left transverse process, adjacent left side of the vertebral body and the left rib here.